Thank you, Madam Chair. My. Here we go again. I rise. I guess I'm sitting this one so I can be close to the microphone. I'm in opposition to this amendment that would prohibit use of funds for abortions under the federal employee health benefit. Here's the thing. Because some lawmakers are consistently unsuccessful in their attempts to make abortion illegal, they try to make it impossible for women to obtain it. Specifically, among other tactics, they use abortion coverage bans to put the procedure financially out of reach for as many women as possible. Many of these bans prohibit insurance coverage of abortion services in government-run health programs. Now, let me just say this. As we see today, federal employees are a prime target of this type coverage ban because some legislators happen to have control over their private health insurance. Here's some important background. The FEHB program provides health insurance to civilian federal employees. The program is a network of private insurance plans that covers more than 8 million federal employees, their dependents, and retirees. And for more than 30 years, some lawmakers have used appropriation bills to deny this coverage for abortion. And this amendment tries to deal a really deadly blow to a very good bill. So, what do we have to say about our federal employees who commit their lives to public service? Should we penalize them because of the source of their health insurance? These workers contribute their own private dollars to pay their premium costs, as do most American workers who receive health insurance through their employees. Government workers deserve the same benefits and access to comprehensive health care as those in the private sector enjoy. And keep in mind that lifting the ban would not mandate that all FEHB plans offer abortion coverage. It simply would allow participating plans to choose whether or not to cover, just as they do in the private marketplace. Leaving women without coverage for safe, common, and sometimes critical health care denies them the comprehensive coverage they need and exposes them to unanticipated additional costs. It is plain common sense to understand that women seek abortion care for many reasons, and we cannot possibly know the circumstances of every woman making medical decisions about her pregnancy. Every pregnancy is different. By limiting coverage options for federal employees, we limit a woman's ability to make decisions that are best for them, their families, and their circumstances. I think we can all agree that living a safe, healthy life is a basic right, and everyone should have control and care for their own bodies. And this includes women who work for the federal government. And let me be loud and clear. Women cannot truly be equal if we don't have control of our own bodies and reproductive lives, including making one of the most important decisions, which is whether, when, or how to become a parent. And this means that every woman should be able to make decisions about pregnancy, including the decision to have an abortion. And the ability to make that decision should not be blocked by banning rightly earned health coverage by hardworking people. This amendment is no good. Vote it down.